Plantar fasciitis. If you get pain in your feet when getting out of bed, or if getting up after sitting down is painful to the heel of your foot, you may have a condition called plantar fasciitis. It's sometimes known as policeman's foot and can be excruciating. Without correct treatment, it can take up to a year to heal. What is plantar fasciitis? Plantar refers to the bottom of the foot, while fascia refers to the supportive tissue. Feet have a thick fibrous band of tissue which stretches from the toes to the heels. This tissue plays an important role in supporting the muscles and the arch of the foot. The pain caused by plantar fasciitis is caused by inflammation of this tissue due to being overstretched. Tiny tears form on the surface of the tissue, making it inflamed and painful. What causes plantar fasciitis? As already mentioned, plantar fasciitis occurs when the plantar fascia is overly stretched. There are a number of factors which can contribute to this. Both men and women can get plantar fasciitis, but it's more common in women. This is probably largely due to unsuitable, fashionable footwear. Although this condition is more prevalent with age, there are many common reasons that can cause an attack. These include being overweight, standing on your feet all day, taking up a new exercise, walking on hard surfaces with uncushioned shoes, regularly wearing high heels and then switching to flats, or wearing house slippers. Symptoms of plantar fasciitis. Pain at the bottom of the foot, particularly in the heel, towards the front or centre of the heel bone, is the first symptom of plantar fasciitis. This can be excruciating when first getting up in the morning and is known as first step pain, or after sitting down. The pain often subsides once the sufferer has walked around a little bit. It can often be worse if non-supportive shoes such as flip-flops or slippers have been worn. Easy to diagnose. Because this pain is very specific, it's often easy to diagnose by a healthcare professional who will ask you questions about the pain and by an examination of the foot where it will be pressed in the area affected. In some cases you may be referred for an X-ray just to check for a stress fracture, but this isn't usually necessary. What treatments are offered for plantar fasciitis? In most cases you'll be advised to rest the foot and avoid any exercise that's making your pain worse. You may also be advised to try one or more of the following treatment options, but note they're not suitable or effective for everyone. A heel pad. A heel pad is sometimes used to cushion the painful heel, especially if you spend a lot of time on your feet. You can buy over-the-counter or custom-made orthotics which fit inside your shoes. These can be made to correct specific imbalances you may have with foot placement or gait. Stretching. Stretching exercises performed 3 to 5 times a day prove very beneficial in not only alleviating plantar fasciitis but preventing a return, as stretching helps elongate the heel cord. Ice. Ice is very good at reducing inflammation. Apply ice packs to your heel or an ice block to massage the plantar fascia before going to bed each night. Pain relievers. Over-the-counter non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, can be helpful in decreasing inflammation and pain. If you have stomach trouble from such drugs, your healthcare provider may prescribe an alternative. A night splint. A night splint is sometimes recommended. This holds your foot at a specific angle and prevents the plantar fascia from shortening during sleep. This can be quite uncomfortable to wear, but for severe cases may be beneficial. Ultrasound. Ultrasound therapy is sometimes used to decrease inflammation and aid healing. Steroid injections. For some, anti-inflammatory steroid injections given directly into your heel may bring temporary relief. These injections can cause other complications if overused, such as shrinking of the fat pad of your heel, which could ultimately increase the pain rather than decrease it. These injections should only be given by a specialist in foot care. Walking cast. For those long-term plantar fasciitis sufferers who've been unresponsive to the usual treatments, your doctor may recommend that you wear a short walking cast. This may have to be worn for about 3 weeks. Wearing a cast ensures that your foot is held in a position that allows the plantar fascia to heal in a stretched rather than shortened position. Shockwave therapy. This is a new procedure called extracorporeal shockwave therapy. It may be prescribed if surgery is the only option left and your symptoms have persisted for more than 6 months. It doesn't involve any actual incisions being made, as it uses high-intensity shockwaves to stimulate healing of the plantar fascia. Surgery for plantar fasciitis. Surgery is used as a last resort if all else has failed and your condition is so debilitating that it's interfering with your daily life. About 1 in every 20 patients requires surgery for plantar fasciitis. This procedure is known as a plantar fascia release and involves releasing a portion of the plantar fascia from the heel bone. This can be performed in one of 2 ways, either through a regular incision or as endoscopic surgery, where a tiny incision allows a miniature scope to be inserted and surgery to be performed. In summary, as with all conditions, prevention is better than cure, and there are definitely some ways to prevent the painful condition of plantar fasciitis. These include keeping your weight under control and wearing comfortable and supportive shoes. Bare feet or very flat shoes are not recommended. And finally, take care when starting or intensifying an exercise program. Recommended reading. As a sufferer myself, I've tried all kinds of treatments and therapies, but nothing's really worked all that well for me. Eventually, after seeing me limping around for weeks, a friend of mine told me about an online program that had been really effective for him. I tried it, and it works. I'm now pain-free and very happy to recommend Plantar Fasciitis Secrets Revealed. Kickstartrecommends.com/plantar fasciitis.